Acute bronchitis. The best treatment options. Acute bronchitis is inflammation of the bronchial tubes. The most common cause of acute bronchitis is a viral or bacterial infection, but other causes may include irritants like tobacco smoke, air pollution, or chemicals. The primary symptom of acute bronchitis is a cough. Other symptoms may include sputum production, sore throat, nasal congestion, headache, muscle aches, and fatigue. Children with acute bronchitis may have symptoms of a runny nose, mild fever, and cough up sputum or vomit mucus. Acute bronchitis can be contagious, however, acute bronchitis caused by exposure to pollutants, tobacco smoke and other chemicals is not contagious. Acute bronchitis is diagnosed by the patient's history, physical exam, and possibly procedures or tests. Acute bronchitis definition. Acute bronchitis is inflammation of the bronchial tubes that usually is caused by viruses or bacteria. Although other irritants, for example, smoke or pollution, also may cause the disease, they are far less frequent causes. A cough lasting 5 or more days suggests acute bronchitis as a cause. People with recurrent acute bronchitis may develop chronic bronchitis. Chronic bronchitis is defined as a cough that occurs every day with sputum production that lasts for at least 3 months, 2 years in a row. Causes of acute bronchitis. Acute bronchitis is inflammation of the bronchial tubes, and a cough lasting 5 or more days suggests acute bronchitis as a cause. People with recurrent acute bronchitis may develop chronic bronchitis. The most common causes of acute bronchitis are viruses: influenza, parainfluenza, RSV, rhinovirus and adenovirus, and coronaviruses are the main viral genera, but many people develop fairly mild symptoms, so often the viral genus is never determined. Bacteria are less common. The causative agents of acute bronchitis. Bacterial causes of the disease include Mycoplasma, Streptococcus, Bordetella, Moraxella, Haemophilus, and Chlamydia pneumoniae. Other irritants may irritate the bronchi and cause acute bronchitis. Symptoms of acute bronchitis. Coughing is the most common symptom of acute bronchitis. The coughing begins early in the disease and usually lasts about 10 to 20 days as it gradually subsides. About 50% of individuals have a productive cough with either clear, yellow, greenish, or occasionally blood-tinged sputum. The other symptoms may include sore throat, nasal congestion, headache, muscle aches, and fatigue. Children may also have a runny nose, mild fever, and may gag or vomit mucus. If a person develops fever, shortness of breath, cyanosis or chest pain, they likely have another problem but not acute bronchitis. Risk factors for acute bronchitis. Risk factors for acute bronchitis are the same as those for getting viral and bacterial infections and to include being in close contact with people that are coughing, sneezing, and touching items that infected persons recently handled. People that are exposed to air pollution, tobacco smoke, and to chemicals that are aerosolized are at higher risk for acute bronchitis. Unfortunately, many people worldwide are at risk. As many as 44 per 1,000 individuals may develop acute bronchitis per year. The highest risks for the disease are the winter months. Acute bronchitis contagious. The majority of people with acute bronchitis are contagious if the cause is an infectious agent such as a virus or bacterium. People are usually less likely to be contagious as the symptoms wane. However, acute bronchitis that is caused by exposure to pollutants, tobacco, smoke, or other environmental agents is not contagious. Acute bronchitis diagnosed. Because acute bronchitis has many causes, is often self-limiting within 10 to 20 days, and its main symptom is coughing, most doctors consider the diagnosis after a history and physical without additional tests. If the diagnosis is not clear or the specific cause needs to be identified, such tests as sputum cytology, throat cultures, influenza tests, chest X-rays, blood gas, procalcitonin levels, and even bronchoscopy have been used to identify specific viral, bacterial and other sources or causes, or rule out more severe illnesses. In many people, the symptoms of acute bronchitis are mild to moderate, and symptoms like cough are treated for a few days before a more extensive workup is begun. Treatments are there for acute bronchitis. Bed rest and supportive care such as reducing coughing are the main treatments for acute bronchitis. In most individuals, antibiotics are not needed, especially those who have as cause viral or environmental factors. For some patients who have wheezing with their cough, beta-2 agonists may be helpful. Perhaps the most useful treatments are directed at reducing coughing symptoms with over-the-counter preparations containing guaifenesin and mucolytics. Acute bronchitis home remedies. Home remedies may help reduce acute bronchitis symptoms. For example, staying well hydrated by drinking fluids, breathing humidified air, and avoiding dairy products, as well as may keep secretions thin and more easily removed. In addition, avoiding air pollution by staying indoors, by avoiding tobacco smoke and other environmental bronchial irritants may reduce symptoms. If symptoms worsen, see your doctor. For children under age 2, and some doctors recommend under age 6, the doctor should be consulted before OTC medicines are used. Contact my doctor about acute bronchitis. Most individuals do not need to contact their doctor, as the disease is usually limited to about 10 to 20 days and resolves. However, the doctor should be seen if symptoms become severe or if fever develops and persists. In addition, if other symptoms develop, short of breath, night sweats, or if the symptoms persist past about 20 days, or if you have repeated bouts of acute bronchitis during the year, you should contact your doctor. Children with suspected acute bronchitis, especially those age 2 and under, should be seen by their pediatric doctor. Some doctors recommend that children under 6 years old be seen by their pediatric doctor. Possible complications of acute bronchitis. Complications of acute bronchitis are infrequent but include pneumonia, viral and or bacterial, chronic bronchitis, asthma, and sinusitis. In addition, depending on the pathogen, complications include tuberculosis, whooping cough, pertussis, and other infectious lung diseases.